All right, shooting down troubles. That's what that seems to be seen, and
Hello?
that's what we'll be doing this morning. You are welcome once again. It's the Daybreak Show, Rock City 101.9 FM, Citizens Forum, like I mentioned earlier. Yes, another round of strike in our hospitals. Not just here in Abeokuta, it's a nationwide thing. The National Association of Residents Doctor, after giving the strike notice to the federal government, actually commenced that strike action this morning. Well, health is wealth, they will say. And besides that, a lot of people are really not happy about the situation within our health sector, within our hospitals. He's been describing different adjectives that are not palatable to the ears. Shambles, not more than gotchas, whatever it is. But apparently, it is important that something should be done to make Nigerians have access to good quality health, and of course for the health sector to also be able to meet the challenge and demand of people. So this morning, quickly, we already have on the line the FMC chapter chairman, National Association of Resident Doctors. Am I correct, sir?
Yes, you are correct. Thank you
Okay,
very much.
thank you. Can you introduce yourself to our listeners?
Good morning, everybody, listeners at home. This is Dr. Taiwo Babajide. I'm the president of Association of Resident Doctors, FMC Abeokuta.
All right, Dr. Olajide, is it true that the
No, I
strike
said
is on?
Babajide.
Babajide, sorry for that. Dr. Babajide, is it true that the strike is on?
Definitely. It's on and it's 100% complied with.
Okay, what exactly is the problem, Babajide?
Okay, well, if I will start from the start, or let me just paraphrase or brief detail viewers at home and people over there what exactly generated to this rancor. Federal government had several agreements with Association of Resident Doctors. These agreements date back to 2013. If I'm still correct, I know that 2017 is rounding up as soon as possible. And let me make some few things clear and I can clear the air. FMC Abeokuta has been issue for about 2 years or thereabout now. We have never done any strike. And I want to make it clear to viewers at home that this strike is not directed at the management of FMC Abeokuta. This strike is directed at the federal government to listen to the plight on the welfare of resident doctors all over the country. And I, as the president of the organization in this chapter, I'm speaking the voice of my members, and I would like to correct some opinion. I'm not speaking what I think. I'm speaking the mind of all resident doctors as it concerns FMC Abeokuta. So can I continue?
Yes, you can. We are listening.
Okay, thank you very much. If I will tell you categorically that as I speak with you now, doctors are owed salary arrears as far back as 2014. 2014 for crying out loud. 2014.
Dr. Babajide, is this the same thing in all the hospitals?
It's the same thing in all federal government and state-owned institutions.
That they are owing all resident doctors that amount and for that period.
They are owing arrears depending on it now varies on centers. Some centers 2 years, some centers the whole of the 4 years, some centers 1 year and a half and what have you.
So there is no center that is not owing at all.
There is no center at all, as I see in the petition, that federal government is not owing salary arrears.
Okay.
That's one. Now let me tell you something again, that there's a term that the federal ministry has employed in explaining to us some of the reasons why we even have shortfalls or why we have been paid half or even less than half of our salaries of our members since 2016. This salary arrears is not what is different from what I'm talking now on shortfall. You can imagine some of our members October, November, and December last year collected the percentage, the fragment of their salaries or what they are supposed to be paid normally. And some centers have not even been paid last year November salary at all. As I speak with you, some centers all over the federation had 30% of their salaries paid to them in this month of August. And this thing is scattered all over the federation like that.
Sorry, Dr. Babajide, sorry for interjecting. Is it salaries or allowance?
Salaries.
No, salaries, your basics.
Yes, salaries.
Okay.
Plus basic. The fragments of them are being paid to our members. You can imagine if you earn maybe 100,000 and you are paid maybe 45,000 and told that it will be corrected. And they keep telling us that this will be corrected, and corrections are not coming. We dialogued the federal government some 2 months ago, and we gave an ultimatum. We gave the 21 days notice of a strike. And within that time, federal government met with us. They made some promises, but yet when we got August salaries alert, we still saw that the shortfalls were still there. And if they are trying to correct the wrongs of the past, and you are still doing that same wrong in the present, when are you going to correct the past when the present is still even wrong? Are you getting what I'm trying to say? That's point number 2. Now, hello, are you still there?
Yes, we're with you.
Yeah, that's point number 2. Now, if you go to another point number 3, our house officers entry point, I can tell you all over the federation as we speak now. All over the federation as we speak now. There is no universal template for house officers entry into the federal the civil service. Some people use a different template, some people use another form of template. I have met the government, we have harmonized all these things. We want something universal for all our members. And the federal government have just to come up with a simple circular to harmonize these things. And when you don't want to explain to us that you need 2-3 months to write a simple circular. When they know how to write circulars overnight, when they want to do whatever they want to do, that is derogatory to us. Now, the things that can make our lives better, they don't know, they cannot write those circulars under 1 week. They can tell us to wait 2 months, 2 months that will eventually enter voice there. And these things have been on for several years. We didn't start these troubles within few months. I'm talking about 3-4 years ago. Now, let me explain something to you again. Another reason why we have gone on this strike. How do you explain it that you are promoting a civil servant, somebody working under the federal government civil service, and you or state government, what have you, and you say you promote the person from we use commerce as medical doctor. You say you promote somebody from commerce 4 to commerce 4 by mathematics. What is or by English definition? What is the definition of promotion? That means the worker is moving from one level to another. So federal government cannot say if somebody is moving from 4, the person should be going to 5. Don't you agree with me what I just said? It's simple English.
Now, Dr. Babajide, from all you have said, how will you react to?
There are too many issues. I'm not finished.
Okay.
I'm only telling you that promotion is supposed to be moved forward. I'm not saying on the same level, and then you increase step. Step is not promotion. It's level that makes promotion. Are you getting what I'm saying now?
Yes.
Now, another issue is about the IPs. Now, in the federal government sector, you have realized that some cadre of federal civil servants, as well as some health workers and some doctors, are on IPs. You may not understand what that means in literal meaning, but some of us are on business. The problem of payment differs, and this to NARD we have seen as unacceptable. We've seen it as unacceptable. You pay some workers, like I'm talking to you now. Some workers got paid before the salary break, and I was not paid before the salary break, owing to these differences in platform. And when I'm talking about shortfalls, a particular platform, IPs, they will be paid without shortfalls. Now, I think which where resident doctors specifically are is the platform that there will be always shortfall. We have to beg, clamor, advocate to get salaries of the work we have done for. The federal government will say no work, no pay. Now they will be doing to us work yet not get paid. You can imagine when you are working as a parastatal, for example, they put some cadre of workers in a particular platform of payment, and they put you people or other people on another platform of payment, and they pay some people for their full salaries, and they pay some people 60-40% of their salaries. You can't expect harmony to be in those kind of settings. It's not possible. You cannot pay me half of my salary and pay someone else their full salary, and expect me to be happy and smiling and going to work every day. Some people will go to work. I will stop going.
Now, Dr.
We live
Babajide,
in the same Nigeria. Hello?
yes, Dr. Babajide, you work with the or at the FMC, and
Yes.
many of those who've been to FMC to seek treatment
Yes.
will swear that they do not pray to ever go there for the simplest treatment because of the bad experience in all forms. Many of them will say FMC is not a place that one should go for treatment because the condition is not just so good. For those who have listened to you, and we want to say all you've talked about is about salaries, payments, and
Okay.
promotions,
Okay.
personal issues. How do you then justify this strike action?
How do we tend to?
Justify the strike action if you
Okay.
compare
Like
the
I've
state
said,
of facility where you are
like I've
working
rightly said,
and
sir.
then the complaints you are making.
Like I've rightly said, for example, it's not doctors will not treat a patient with just bare hands. We find a situation in our hospitals where facilities are almost there. Those are part of the problems we have. You understand what I'm saying? I'm not finished. I'm still on it. If I keep talking about some of these problems, I may not live here at the end of today. Now, for example, you said FMC Abeokuta is a good place to come to treatment. I will tell you academically, yes. But the problem we have has been problem of federal government making some equipment even to the level of common drugs, disposables available as when due. So we have a new management now who is just in town and they are trying to acclimatize, to make things better. Like I said earlier when I started this conversation, this strike is not directed at the management of the doctor. This strike is directed at the federal ministry and the federal government so that they can know our plight. So on the issue of people coming here and getting good care, that would be based on management and making the right things available for doctors. I cannot give you good service when in my consulting room there are about 50 patients waiting to see one doctor, 30 patients waiting to see one doctor. Those things, consulting rooms are not even enough. The doctors themselves are not even enough. You find as many in evidence of Africa where so many things are not working as are supposed to be working in the laboratories and what have you. You don't expect a doctor. A doctor is not a traditional person that we consult or opinion and then be making diagnosis on that. The doctor will make diagnosis based on results of investigation as well as the clinical assessment based on your complaints and signs and symptoms. So if the doctor is sending for investigation, requesting for MRI, then for CT scan, then facilities are not working and they should be working. You don't expect the doctor to do any magic. So the patients will complain. These are part of the issues we are talking about. You don't expect that we have 3 doctors working at the GOPD, or maybe 5 are working at GOPD, or there are supposed to be 7 or 8 doctors working at GOPD, and as we speak, we have maybe 4 or 5 consulting rooms. So the other doctors have nothing to do but to just close around a little. That is not even to tell you that doctors are enough, because if we have 30 consulting rooms in FMC Abeokuta for outpatient treatment alone, I'm telling you, patients will overflood it.
Okay, Dr.
So,
Babajide. Dr.
okay, thank you.
Babajide, okay, why now that we
Yes.
have the ASU strike pending, are you sure it's a right timing for the strike by the NARD doctors?
The question of right timing may not come into play here. We have given federal government ample time to respond to our plight. Some of our complaints can be corrected by simple circulars. Sometimes it's not difficult for our government to issue circulars. It's not even person they issue circulars every day. And why wait 2 months to dialogue with us again on issues that we know can be corrected by simple circulars? Honestly, we as Nigerians, we don't need to continue to move back and forth. Why? No doctor wants to see if our patient suffer. No doctor, a doctor is a human being. We are not happy that people are going through stress. Even while we are working, not to talk of now that things are down. But like I told you, the problem is not a local problem. The problem is not a FMC alone.
Yeah,
So it's not
we
the management of
understand
FMC.
that. Yeah, we
Yes.
understand that.
So
We are not
the
looking
problem is
at.
not particular to FMC alone. Even some of these problems, if the state government can come assist FMC, we will not know.
Okay, we lost that call. We lost
Okay.
connection.
Yes, we'll still try and re-establish contact with Dr.
Babajide.
Babajide. Chienye, can you just remind our people of those grounds coming from the LARD?
All right. Some of the issues that were raised by the NARD, they include the failure to pay the salary shortfall of year 2016 and January to May 2017. And then the second one, failure to rectify the salary shortfall from August 2017. The third one, failure to secularize the House officers' entry point, and then failure to also correct the stagnation of promotion of the members and properly place them on their appropriate grade level. Then we also have the failure to enroll and capture the members on the Integrated Personnel Payments Information System, IPS, and that was what he mentioned earlier, as well as the failure to budget, deduct, and remit both the employer and employees' contributions over their pension to the retirement savings account since 2013.
All right. That's coming from the NARD themselves. And of course, like I said, it's a national strike action going on. Let's take this short break and see if we can re-establish contact with Dr. Babajide. All right, yes, we are glad to have him back. Dr. Taiwo Babajide, Chartered Chairman of the National Association of Resident Doctors, FMC Abeokuta. Dr. Babajide. All right. Now let me also ask you this. The residency program, it's a year program. Hello? The residency program is a year program which is aimed at retraining or training doctors for the thing. Is this correct? Yes, I said it is aimed at training. Okay. Yes, so you are on, Babajide.
Trying to key into as regards to tenureship of president. So as regards to duration, I may not be able to tell categorically now that this is the number of years because that and I think is under review.
But it is a program aimed at training doctors.
Yes.
Okay.
The second statement is correct. It is a program aimed at making doctors or training doctors or raising conductors from doctors.
Okay, now if that is true, what is the justification then for this group of doctors to be persistent, to be peculiar, to be troubled about their salaries when after all?
Let me tell you. Let me make this clear. When taking a resident it's also covered civil service and employment rule. It's almost apart of the fact that it is tenure. Apply.
Yes.
So apart from the training and the tenure, all other civil service rules, resident doctors are not medical students. Resident doctors are doctors that have graduated from medical school and have doctors already. Let me tell you, not every doctor will go through this cadre of service from being a doctor and then aspiring to become a consultant. Some doctors after medical school will take jobs, take some other civil service as medical officers and remain that way. Also, apart from training program, being a training program, all other civil service rules, all other professional civil service are fine. So that the question here that says whether the doctors can go on strike or not, they are not coming at all.
Okay. All right. Thank you, doctor.
Doctors can fight for strike.
Okay. So from my panel, so the strike action, as far as you are concerned, is effective and is 100% being
I'm not
compliant.
hearing you very well anymore.
The strike action, as far as you are concerned, is 100% being complied with and is effective. Is that so?
100%, absolutely.
All right. Okay, thank you. Let's leave you to the other things. Dr. Taiwo Babajide.
Thank you very much. I want to thank for not for the opportunity.
Okay.
It's been my pleasure.
All right, you've heard him, the FMC chapter chairman of the National Association of Resident Doctors, Dr. Taiwo Babajide. He highlighted their position, different positions about salaries, why and how government has either not paid some of them since 2013 or have been paying some of them half salaries. Salaries is repeated and not allowances from 2013. And of course, he also went into explanation to let us know that residency program of doctors is like a full civil service employment, which will come with all the civil service regulation rules and opportunities. And the residency doctor is different from a medical doctor. It's for doctors who wants to graduate into becoming consultants. Yes, it's a national strike and not just about any particular teaching hospital. And the strike is on and comprehensive.
Okay, but Dele, one thing beats my imagination. It's always all about doctors. What about the nurses and other health workers?
Well, interestingly, of course, that's a specialized department. I'm talking of the health sector itself, and very key to human existence. Though they can hold people by the jugular, whether they are right or wrong, it's not my own position.
Sure.
And not, I don't have the power to say that for now. But I think that is why any strike action or any public action from those group of people always have a direct impact and then visible to the public, despite the growing number of private hospitals that are in the country. The truth is that in many places, the government hospitals are still cheaper
Than private.
and that is where you have a cluster of specialists, those who can, okay, if A does not know what to do or stuck somewhere, he can immediately call B, C, D, E, F to come and check the same issue. Combination of good to say. That's why those sector is very key and pronounce each. And let's give our people the opportunity to also say their own mind. This morning we are asking you, for those of you who've been to any of the hospitals, what is that experience you've seen there, or you know somebody who's been there. And of course, you can also comment on what you heard Dr. Taiwo Babajide talked about in the course of the interview.
The studio lines is 0809-868-7344 or 0909-146-9670 are the numbers to call. And then for the short code dial 321208 it is. Type rock, you leave a space, type your message, include your name, and then you send it to 32120. The Twitter handle is there. Tweet at us at Rock City FM, and also the Facebook fan page Rock City 101.9 FM. And remember, it's only 2 minutes that is allotted to every caller.
Okay, let's see who goes first. Who is the first caller?
Hello.
Oh, thank God I'm the first caller. Good morning, sir.
Morning.
Good morning.
My name is John, calling from Abeokuta.
Thank you.
Okay? What the doctor, Babajide, is saying is very correct. We don't have enough doctors. At least I want to share my experience. The last time I went to the hospital, because of malaria, I was there 3 days. I went the first day in the morning. I left around 3. I was not attended to. I went the second day. I had to run some tests and go back to come back for the result the third day. The third day I was in the hospital from 7 o'clock till about 4 o'clock. When the nurse now came out, called my name and said, please, we are sorry you have to come back tomorrow, that there's no doctor to attend to you. I was now shouting. I said, for what? Is this my office for 3 days that I can never come back to this place if I leave this place? So
that was a public hospital there. Public hospital.
FMC.
Okay, FMC, the same
FMC.
FMC.
Yes,
Okay.
FMC Idiaba. So when I started screaming, he now called me to come and meet one doctor, a lady. that just attended to me, and I left. And I made up my mind that I will not go to FMC again. In fact, to be frank with you, I do self-medication. At home, if I'm feeling anyhow, I'll just go to the pharmacy and get some drugs. Don't go to the hospital. The treatment is so bad, it's so poor. That is my experience.
Okay, but that's
not enough.
all right. But Joy, that's not the only health facility that we have in Ogun State. Rather than do
All of them are.
self-medication, because you know the implications too of doing self-medication.
Yes, if I don't do self-medication, I go to private. But if I don't have money to go to private, I'll do self-medication. That's what I do.
Thank you, Joy, for sharing that your experience with us. It's crucial, the experience you just given us. I was just talking about the experience of other people at FMC. She appears to have corroborated that. Let's add the other call to it. Hello.
Hello, we have you. Good morning. Hello.
Hello?
You are on. Morning.
I'm Bosse. I'm calling from LI.
Okay. All right, thank you, Bosse.
Health sector is one of the systems that we have that is not in this country that we have. It's a pity that is doctors from the Federal Medical Center that are talking this morning, because the experience of Federal Medical Center has not been a good one at all. I'm glad it is Dr. Taiwo that was talking. You asked him to justify the reason for the strike this morning. And sincerely to me, he couldn't justify that. Because the same Dr. Taiwo that we are talking, they are not bothered. Have you been to the FSS before?
No, I've not.
If you have ever been there, you will see the way that place is constructed. They are not concerned about the health of those people taking care of and those that are working with them. This same Dr. Taiwo cannot see.
Sorry, Bosse, I don't want us to personalize it. Dr. Taiwo spoke on behalf, like he said, he spoke the mind of every resident doctors, not just in Idaba, but elsewhere.
As if they are the only person working in the hospital that everything is wrong with. No, everybody are keeping their own. It's not just about the doctors there. It's about working together and putting stuff. And I see, that's what I believe. When you get to Federal Medical Center Abeokuta, where they contact their patients, it's not good at all. You can't go that place to people. When rain is falling, not better we have to start running away. That place can be like supposed to rain. So I see this like, it's like ordinary flood. There's nothing there that will keep them. So wait. Somebody will tell them they are on afternoon. Somebody will tell them they are on morning duty. Themselves. So you have to come and see what I'm talking about at Federal Medical Center. They'll be pushing them. This one will see you. Don't give me patient today. Don't give me that patient today. It's terrible. They should not be concerned about the most and the alone. They should be concerned about the patient they are treating. Thank you.
Thank you very much, Bosse.
Thank you. Okay, another angle. She spoke like somebody who knows
FMC so well.
Yes, so well. Thank you. Hello.
Hello. Good morning, Mr.
Good morning.
Yeah, my name is Brother Paul. Yeah, when we are talking about restructuring, I think it's more important in this health sector of a thing. Some of us visit us this government-owned hospital. They treat us as if they are the boss. Not minding we pay for the service rendered. You see them being so hostile to you. You see them being, they don't have any regard, no matter who you are. Except you visit a place they call corporate, which is specially made for his business. I don't know. Some of these doctors, they have their own private clinic. At times you see them diverting those patients to their own private clinic. I think in a situation whereby the medical director is all and all, I think something should be done about these hospitals. Thank you very much.
Okay, thank you very much. Okay, we squeeze in one more call. Hello, good morning.
Good morning, Chienye.
Good morning.
You see, until the federal government incorporates traditional medicine, even also we will not have it perfect in this country. Me, Olushola Johnson, now well, Almighty God have forsaken all these hospitals, because the day we went to this estate, they did not do BP for my wife, and they were prescribing hypertension drug to her. It was a program on Tuesday the other time.
Yes, you did.
Yes, it was before we went to another place, and we found out that my wife was not having hypertension. She was giving Modretic and all. And I told her, I said, this FMC, don't let us go there. She said it's a government hospital, she will go there. But she learned her lesson, and I learned my lesson too. Ọmọ àgbo lè ní èmi ò jẹ́ mi tablet yìí o, àlàáfíà ní fún Nàìjíríà.
Àlàáfíà ni fún gbogbo wa.
All right, thank you. Okay, so do we check messages or we still
Yes.
check?
Okay. 0809868734. Hello. Good morning.
Hello, good morning.
Good morning.
How are you?
Fine, thank you. And you, sir?
I'm fine. I am okay for my issue.
Thank you for joining us.
You know, the situation is the same everywhere. From federal medical to state hospitals. Here in Ayodo, there was a day my wife went to the hospital from 7 o'clock. She was not attended to us till after 3. I went there. The doctor was receiving visitors and leaving that are willing, that are trembling. I wonder what is actually happening. And you see, in Ayodo, as good as not speaking, and they could use it 2 doctors at a time. They say just one doctor. He may not be on duty. It is only these nurses that will be attending to people. I wonder what is happening. And it is all over that our government is to be replaced. If they have actually done the needful, why are they traveling out to receive medication? There should be a clause in the constitution that will compel everybody to receive medication here in Nigeria. It is then that you know that they need to improve our facility. Our life to them is they don't want it. They don't actually value our life. So,
I understand where you are coming from, but I don't think to say that will be very appropriate. That they don't value your life, they don't. Some of the actions may. I'm not taking anything away from what you are saying.
When necessary materials are not on ground, you see some of the hospitals so dilapidated. There are no enough personnel. There are no doctors. You go to a hospital, you go and buy outside.
Thank you. I'm okay.
God bless.
God bless you too.
Can I just end this segment with messages?
Okay, we have this message from Olaolu from Ijon. But Senator Ungige said the allowance will be paid in badges. Is it true? Okay, he's trying to ask Dr. Taiwo. Then, are they the only union that are being affected? What of the nurses and the other health workers that are, and even the conditions of the hospital in the nation? That's Olaolu who sent in that one. That's it for the messages.
All right, let me quickly just say, Dr. Babajide, I'll just say, just monitor, listen, and if you want to react or clarify any issue raised, you can do so. I will permit you to do so. Just keep listening, monitor the station, and then let's hear from you if you want to clarify or react to any of the issues raised. We'll take this break to permit the national news exchange to come out. After that, Dele and Chienye will still be here. We are looking at the National Association of Resident Doctors strike, which commenced this morning. The reality, really, in most hospitals, in terms of numbers, the resident doctors are always the ones that are visible. The other group of doctors, the consultants, are the senior people there, but they are the ones most times that you have your first encounter with if you go to the hospital. The resident doctors, they are equally very pivotal in delivering of care in the hospitals. We'll take the break. We will be back. The answer is now. It's now. It cannot be tomorrow. Efforts to let Nigeria become that country the Almighty God has ascribed it to be, with all the potentials, natural endowment. Yes, the answer to let that be is now. Whatever you can do to make the country the land of everybody's dream is what you should do today. It's good to know that you are still there listening to Rock City 101.9 FM, the Tuesday edition Citizens Forum. We are looking at the strike action by the National Association of Residents Doctors. Earlier on, we spoke with the FFC chapter chairman, Dr. Taiwo Babajide, on the different issues, and we are beginning to take reports, comments, opinion from you. I'm sure Dr. Babajide is also listening, so if there's need for him to respond or clarify any of the issues raised, for sure he will do so. Alright, we go back to begin to pick your calls.
0809-868-7344.
Good morning. Yeah, once again, my name is Sunday Amolaolu. I'm calling from Abeokuta.
You're welcome.
Yes. You see, I feel very disturbed when I hear that medical doctors are going on strike. For what? At least we should concentrate on molding lives of people, not killing them. There are other ways by which people, instead of unnecessarily going on strike, like we had at FMC, report before that woman spoke this morning that what is going on in FMC needs urgent attention in terms of like a drastic attitude of medical officers, even tolerating down nurses and what have you there. Because they fight only on money without caring for the patients that are dying. Look, these people will be on all of them if they continue to die. Thank you. Good morning.
Thank you very much. Good morning. Hello? We have you.
Hello, good morning.
Good morning.
Yes, I'm Rock City FM.
Yes, this is Rock City FM.
Yeah.
Okay, sorry, you may try and call back 0809-868-7344 or 0909-146-9670. Hello? Okay, we lost that call. Send your messages via the short code 32120. Hello, good morning. Hello?
Good morning. Yeah.
Good morning, sir.
How are you?
Fine, thank you. And you?
Yeah, I'm fine. Good morning.
Morning, sir.
Yeah, I'm Taiwo. I'm from Capcom area in Japan. Yes, we have too many problems on hand. We are talking about the doctors, not to?
Yes.
Yes.
Yes. Well, first of all, I've always been saying it. The language our people understand is right. Is right. On the other hand, you cannot blame this present government. It has been so bad for the past 20 years. There has been corruption everywhere. Money has been stolen. The economy is in shambles. Thank God, we are now moving out of it. So my appeal is both to the federal government and to the residents. Residents are just on firstly must,
Hello?
they are also going to preserve life. You can understand that. And appeal to federal government to help see to their demands. Meet their demands as much as possible. Find money. Even if it comes to borrowing money, let them do it. Thank you. God bless Nigeria.
God bless us all. Thank you too. Hello, good morning.
Hello, good morning, Auntie Chienye.
Good morning.
Good morning, Mr. Dele. This is Mola Oluwabi. I'm calling from Akila.
Thank you.
On the strike, I want to say the common trend that runs through this strike these days is that it does not have the interest of the common man and humanity at heart. For example, the doctor's demand does not accommodate how to ameliorate the people's lives when they patronize this hospital. That is reduction in the fees payable. The cost chargeable in our hospitals are too high. This must be on their agenda for any strike. This is the reason people cannot afford to go to hospital, and as a result of keeping their ailments to themselves or at best patronize quacks, other homes and other insurance authorities. A strike along this line will be very popular. Other areas to challenge their grievances are
also there. And that will be very reasonable. Anything aside this will be tantamount to take their vote. Thank you very much.
Thank you very much. Moses Idemudia, strike should not be a weapon. Dialogue remains the best option for pressing home any demand, rather than paralyze activities. And then where we have two elephants fight, the grass is the worst hit. As a result of this action, many lives will be lost. So dialogue is the only way out and not strike. That's still from Moses Idemudia. Then we have this one from Lade. Well, we all know it's the masses that will suffer more. Then we have Timi Taiwo Ariwoko, but on the Twitter handle, Shobolaru Timi Taiwo. Resident doctors are just doctors in training. Why must they go on strike?
Sorry, Dr. Taiwo has clarified that they are not just doctors in training. Please clarify that.
Okay, they're just like an IT student. That's from Shobola.
No, they are not.
Okay, then we move on to this one by Billionaire Ajishafe. Federal government is degrading Nigerian doctors. Hashtag PMB. He traveled on medical tourism. The National Association received 5 billion naira for car allowance and doctors are not paid. Then Dolani Robots. If both federal government and state government do the needful, the resident doctors won't embark on strike. Then Taiwo Tolulokwe has this tweet: Dr. Babajide should not exonerate the management of FMC Abeokuta from the problem. I think they're appointed by the federal government. Then Saka Raman Olayode: our government and resident doctors don't care about anybody's life. We should take care of our lives by ourselves. No adequate material in all the hospitals. Dolani Robot still: just because our leaders don't value the life of its citizens, how can a doctor attend to 50 patients per day? That's from Dolani Robots. And then we have this one from Kola. Boss, it's hard to listen. Everyone becomes eloquent after leaving government. Okay. Dolani Robots, owing doctors salary arrears since 2013 till date, and you want effective work from them, it's not done anywhere. Taiwo Tolulokwe, doctors should always consider their hypocritical oath considering the existing realities. Medicine is a call, it's only God that can reward. Dolani Robots, federal government has to take responsibility of Nigerian health sector and improve it for the benefit of the populace at large. Then we have Sakaraman or Layode. Also, by going to any government hospital, no sufficient doctor, no drugs, how can they save a life? God will save us in Nigeria. Then we have Mercy Femi. Resident doctors are not to blame since the public health sector is underfunded. If not, what made President Buhari to go abroad for treatment? And back to Taiwo Tolulokwe, government and resident doctors should be held responsible for innocent lives that will be lost during the strike. I wish they are charged. Mercy Femi, Ogun State Ministry of Health shuts unlicensed health facilities, but the government refused to employ health workers in its institution in the state. Taiwo Tolulokwe again, we have a state of anarchy in the health sector. What is the result? Premature deaths, epidemic, plague. May God help our dear country, Nigeria. The Mercy Femi, masses are left to die since the government will only call meeting during strike, and most politicians get treatment abroad. They are not affected, and no difference between APC and PDP governments. Strikes here and there. God will judge everyone. Governments at all levels are not sincere. That's still from Mercy Femi. And away from that one and picking on this one from Abe Fagbemi. Why strike is the best way in our country? Or is the federal government not in the know about the ongoing ASU and resident doctor strike at the same time? Something must be done, please. Then Yemi Da Vinci, a lot of people will release anger and vituperations on the resident doctors and not on the federal government, which is sad, as federal government is the cause of this. Yes, the doctors have their own shortcomings, but this is an issue of the federal government behaving in an dishonorable manner. Okay, that's from Yemi Da Vinci still. Then Adekunle Kainde, PMB, said he will not rest until Nigeria is better. Is the collapse of major systems the betterment which he meant? He was lucky. What about the downtrodden? Okay, that's from Adekunle Kehinde. Then Yemi Da Vinci. One will be right to start thinking that maybe some staff of Federal Ministry of Health are doing some funny things to doctors' salaries. I would like to appeal to resident doctors to please shelve this action based on Hippocratic oath or maybe skeletal services. And the resident doctors and indeed the health sector will continue to be treated with levity till all public officials use the government hospitals. That's still from Yemi Da Vinci.
All right. Again, let's quickly just mention this. Our response, yes, they matter, but let us just even on our own side not be hypocritical. It's actually not easy running government. It's actually not easy. For instance, somebody who says that the president says he will not rest until he gets Nigeria better. I mean, that would be mischievous to now interpret it as saying he's looking for the collapse of any sector. I think it's the other way around. I know that was a deliberate message aimed at achieving something else. That's not the kind of idea we are propagating here, please. Hello, let's move on.
Okay, hello, good morning. Hello, we have.
So,
My name is Kajim.
Okay, thank you for joining us.
Yeah, you're welcome. Who am I to blame the doctor? Who am I to blame the doctor? For president, when president went to London for treatment, even the presidential jet was packed with the president. Calculated cost that was used for 3 days for that presidential jet. If our hospital has been in order, with the president was taken to
Kazim,
up
Kazim, I'm not sure the presidential jet was packed with the president. The presidential jet was here in Abuja.
in Abuja, yes.
Yes.
It's okay. I heard you. Don't worry. It was just of reason. This governor of Kogi was taken to abroad eye treatment, common eye treatment. If you are saying because of the security, presently our president is in Daura. Are you telling me there is no security there? Because our facility is not in order. My brother, you don't blame these people. When you are working and you are not paid, all these people are paying for life before even on the 25th. And these people have their own family too. Forget about they have the hospital. If the government is in order, who will go to their private hospital? Nobody will go. We want cheaper things. But when the government hospital is not there, they move to private hospital. So I'm not blaming them. Thank you. Good morning.
Okay, thank you very much. Good morning. 0809-868-7344 or 0909-146-9670. Good morning.
My name is Dr. Nkom from Ashiro.
Thank you.
I'm not a resident doctor, and certain things are kept very, very clear because we don't understand what we are discussing. We are not discussing FMC, not enough doctors. We are talking of the national strike by National Association of, that is all resident doctors in this country. They are not all working in FMC, Abeokuta, or maybe Lagos or whatever. It's a fundamental issue, and that is beyond. I know that we are aggrieved about the quality of service, but let me just make one statistic. People will never know how many patients die in hospital because of no electricity, not because of resident doctor, not. We may never know how many patients have been maimed because there is no water. I don't know if resident doctors are to provide water to and electricity. Let us leave that one aside. Let us go. Why are they not? The issue is that an agreement has been signed. Offer this like as should be. And then people are saying, oh, doctors are not supposed to do this one. But if your in-law is a doctor, you will not give your wife, your daughter, the fee because he's a resident doctor. He has to pay the bride price. Abi Dele, won't they pay bride price? Go to put a market and just mention your name as a doctor, and you are finished. The price goes 3 times. I don't that people will not know, but I'm trying to be a bit sarcastic. But the truth of the matter, let us look back and say no. Why are hospitals not working? it has nothing to do with resident doctors. Resident doctors don't run hospitals. It's run by consultants and the administration. And perhaps by government itself. There are a lot of things going on which you cannot say. But let me tell you, the resident doctors have the right to do that. I cannot talk more than that because of the position I occupy. Thank you very much.
All right, thank you, medical doctor Ebenezer Nkong. All right, thank you for your inside contribution.
98687344 or 0909-146-9670. Okay, we have a caller. Hello? Hello?
Hello.
Yes.
Good morning.
Good morning. My name is Abdul Rashid from Badiri.
Thank you.
I think just as a rider to what the last caller said, you see, in Nigeria as a whole, we have a way of also playing around with words, saying all doctors and all this, all doctors and all that. The president went outside the country and said Nigerians are fantastically corrupt. They didn't say somebody from Ogun or Oyo or Niger.
The president went and said some Nigerians are fantastically corrupt.
Well, I beg to disagree. I can share with you where he said Nigerians, not that some Nigerians. He didn't say some Nigerians. He said Nigerians are fantastically corrupt. You understand? But that's not even the issue. The issue is there's a place of welfare. I know. But you look at some of the doctors or health practitioners, you understand, and you begin to imagine that even when they are paid, is this the way they behave? Look at some nurses, even the fact that they are paid. I tell you, you see them and you begin to imagine that now, apart from the training, nursing training, we also give them some training about maybe emotions, how you can also, deal with people and stuff like that. Because you begin to imagine a young lady of maybe 27, a nurse, treating an old person as if, look, if you don't come here, I'm going to do, all this kind of mentality. That is why people are not really relating the issue of welfare to their actual attitude to say, okay, you think people are not being paid. That is why this thing is happening, or is it that you're just by nature just wicked? So that's what I want us to settle. The truth of the matter, the last caller said, every profession you've gotten to see people who are bad. When we are saying doctors, this is the way they behave. I do not support that, but I'm saying most of us in other professions we have one.
Okay.
This respect, this issue, this I think we need to separate it. Welfare, yes, they are not being paid, but what of their attitude? Look at Olusola Johnson, what he said.
You have your 2 minutes exhausted.
Right,
thank you. Nigerians are fantastically corrupt, I think, is a statement made popular by the former British Prime Minister, David Cameron, and not our president. Let's
we wrap it up
it
with the messages. We have this one from Joy from Abeokuta. Good morning. For this act of irresponsibility towards the health sector, it should stop. I think all the politicians should be banned from going to have medical treatment abroad, and by so doing, the government will take proper care of our health sector. God bless Rock City. Joy from Abeokuta. Hello, presenter. Medical doctors do their job. It's good, but it seems that they are okay because of their attitude. What their colleagues in the local governments are doing to other health workers in Ogun State. They don't want other workers to get to the top. The other doctors go on strike. They need deliverance. Ayo and Lamon from Abeokuta sent in that one. Then every sector needs government intervention. If a petrol tanker driver refuses to lift products due to bad roads, then that leads to crash. Then how shall we cope? That was sent in by Yinka. Then where is Dr. Nkom? This is the time we need him to contribute. Ololade from Ashuru sent in that one. Okay, he just contributed. Doctors should not be blamed, but government that doesn't honor agreements should be blamed. MOK from Ayetoro sent in that one. Then Yinka still, our doctors are insensitive and inconsiderate. When someone asked my daughter why she doesn't want to be a doctor, her reply was that they always go on strike. Okay, that's an experience being shared by Yinka. Then we have this one from Cosmos. Medical and educational institution, whether public or private, should be independent and employ directly their staff, while government should merely regulate them equally. These are matters for imperative social reconstruction and re-attitudinization. Cosmos sent in that one. Then we have this one from Ade. The strike is costly since it affects lives, but doctors should not be blamed, but the government. For not having masses' interest in mind, a law should be enacted banning all government officials from president downwards from traveling abroad for treatment. And when this is put in place, they will upgrade our hospitals as expected. No responsible government will fail to fulfill an agreement that was signed with the workforce since 1999, and yet they are getting theirs. Ade. Then lastly, Ogun State government should please pay workers their deductions in the interest of the citizens. Sam Ogedeji sent in that one. That's it.
All right, we thank everybody who's contributed. In addition to the good things, the correct things many of you have said, I will also add this, that it is good that every of us, every Nigerian individual, begin to examine oneself. Attitudinal change, positive thinking, and positive action is equally very important, not just structural change that is being clamored for. Dele Ayodo is my name. I say thank you for again listening. God bless you all. God bless Nigeria, and God bless Rock City.
And I remain Chienye Egwuonwu. Let's continue to do the right thing always. Good morning.